Dr. Richard Harmon seized Ava's wrist the moment she stepped out of bay, 4 fingers crushing down hard enough to leave marks, and slammed her patient chart against the wall. "You are done," he snarled, his face inches from hers, voice shaking with a fury that had nothing to do with medicine. "I will have your license shredded by morning. I will make sure you never touch another patient as long as you live." 7 people were breathing because of her hands. 7 families still had someone to go home to. And this man with the white coat and the power was trying to destroy her for it. Then the FBI walked through the door, and everything got worse. Welcome. If this is your first time here, please subscribe and hit that bell so you never miss a story like this one. Drop your city in the comments right now. I want to see how far this story travels. Now stay with me. Every single second of this is worth it. The emergency room at Mercy General Hospital had seen bad nights before. Nurses who had worked there for 20 years would tell you about the ice storm of 2011, when 12 cars piled up on the overpass and the ambulances came in waves. They would tell you about the 4th of July shooting that left 9 people critical. They would tell you a lot of things about bad nights, but none of them had a word yet for what happened on a Thursday in October at 9:47 in the evening, when the radio crackled to life and the dispatcher's voice broke through the noise of the ER like something cold and sharp. "Mercy General, this is EMS Unit 4. We have a mass casualty event. Highway 9 bridge collapse. 7 critical incoming. ETA 6 minutes. Repeat 7 critical. All hands." For exactly 2 seconds, the ER went silent. Then it exploded. Charge nurse Patricia Elms grabbed the radio. "Say again, Unit 4. 7 critical. Affirmative. Construction scaffolding gave way. We've got crush injuries, internal trauma, at least 2, with compromised airways. 1 pediatric. Surgeons need to be ready." Patricia set the radio down and turned to face her team. Her face had gone a particular shade of pale that the younger nurses had never seen on her before. She had been doing this for 31 years. When Patricia Elms went pale, you paid attention. "Someone get Dr. Clean on the phone right now," she said. "Where is he?" A resident named Marcus looked up from a chart. "He called in from the highway 20 minutes ago. He's stuck in traffic. There's a backup because of..." He stopped. He put the pieces together. "Because of the bridge. Get him anyway. Get every attending we have in this building. Someone page cardiothoracic. Someone else open trauma bays 1 through 4. We need blood products on standby. We need anesthesia, and I need every person on this floor moving in the next 30 seconds. The ER became a kind of controlled chaos that only existed in places where people had been trained to function at the edge of disaster. Carts rolled, doors opened, voices overlapped and cut through each other, and in the middle of all of it, standing near the nurse's station with a patient chart in her hand and a pen behind her ear, was Ava Reyes. She was 29 years old, 4 months into her first nursing position, and according to her personnel file, she had graduated from a mid-tier nursing program in Phoenix 18 months ago. Her evaluations noted that she was quiet, competent, slightly withdrawn, and showed a remarkable ability to stay calm under pressure. Her supervising nurse had written on her last review that Ava sometimes seemed to know things she hadn't been taught yet, but had chalked that up to natural instinct. Ava set the chart down. She did not look panicked. She did not look excited. She looked the way a person looks when something they have been quietly dreading has finally arrived and there is nothing left to do but step into it. She walked to Patricia. "What do you need me on?" Patricia barely glanced at her. "Reyes, I need you on Bay 2. Dr. Solis is going to be the lead you assist. Do not make any independent decisions. Do not touch anything without clearance. Do you understand me?" "Yes," Ava said. But there was something in the way she said it, something careful and measured, like a person choosing their words, not because they agreed, but because they understood this was not the moment to argue. The ambulances arrived in pairs. The first 2 came screaming into the bay at 9:53. The back doors opened, and the paramedics were talking fast, rattling off vitals and injuries with the machine gun cadence of people who had already been working the scene for 15 minutes before they got here. Male 44, BP 80 over 50, chest trauma, suspected hemothorax, lost consciousness twice in transport. Female 31, crush injury to the lower extremities, tourniquet applied on scene, pulses thready. They moved the patients through. The ER staff absorbed them, each person snapping into their role, and for the first few minutes it held together. It looked almost manageable. Then the third ambulance came, and the fourth, and the radio crackled again. Mercy General, heads up. We have two more on the way. One of them is the pediatric, 8 years old, blunt force trauma, suspected intracranial bleed. He is not stable. Patricia pressed her hands flat against the nurse's station counter and closed her eyes for one single breath. Then she opened them. Where is Dr. Solis? Marcus was already there. Bay 2, but he's on the chest trauma patient and he cannot leave. The hemothorax is getting worse. And attending coverage. Dr. Perez is in surgery upstairs. She cannot be pulled. Dr. Wen is en route, but he's 40 minutes out. 40. Patricia stopped herself. She looked at the board. She counted. 4 incoming patients, 2 of them critical. One of them a child, and the only surgeon in the building was elbow deep in a chest cavity with no way out. This was the moment. This was the specific, terrible, irreversible moment when the system failed. Not because of any single person's fault, not because anyone had done anything wrong, simply because the math had stopped working. And Ava Reyes stepped forward. Patricia. Her voice was low and very even. The boy, the pediatric. What's his presentation? Patricia looked at her. Reyes, tell me his presentation. There was something in Ava's voice that made Patricia stop. She had been in this field for 3 decades. She knew the difference between a nurse who was panicking and reaching for something to do and a nurse who was asking because they already knew what to do and needed the information to do it. She had heard that voice 100 times. She had never heard it from someone 4 months out of nursing school. Blunt force suspected intracranial bleed coming in unconscious, Patricia said slowly. They've got him ventilated. His pupils, they were unequal on scene. Ava nodded once. He's going to herniate if we don't get ahead of the pressure. When he comes in, I need mannitol drawn and ready. I need the head of the bed elevated to 30 degrees the moment he's transferred. I need someone with the bag valve mask who knows how to hyperventilate at exactly 14 to 16 breaths per minute to drop the CO2 and buy us time. And I need someone to get the on-call neurosurgeon on the phone right now because I can keep him alive, but I cannot keep him alive forever. The words fell into the room like stones into still water. Nobody moved. Patricia said very quietly, "Where did you learn that?" Ava held her gaze. "Does it matter right now?" It did not matter right now. "Elkins?" Patricia called out, her voice sharp. "Draw the mannitol. Davis, you're on the bag mask. Someone get neurology on the line." She looked at Ava for one more second, something shifting in her expression that was hard to name. Then she said, "Bay 4 is yours." Ava moved. The boy came in at 10:02. His name, they would learn later, was Noah. He was 8 years old, and he had been on the bridge with his father walking back to their car after a baseball game when the scaffolding came down. His father was in Bay 1. Noah was in Bay 4, and he was not breathing on his own, and his left pupil was blown wide open like a door off its hinges. Ava was there when they wheeled him in. She was already gloved, already positioned. She looked at the paramedic and said, "Walk me through the last 5 minutes." "Unconscious since scene. GCS of 4. We've been ventilating. 2 large bore IVs placed. We couldn't get a line in the left AC. It collapsed. Did you try Oh, the paramedic blinked. Yes, right tibia. It's patent. Good. Run the mannitol through it, right now." She was already at the head of the bed, her hands moving with sureness that had no business existing in someone who was supposed to be on her first real job. She checked the tube position. She adjusted it 2 millimeters. She looked at Davis, who was standing with the bag valve mask, and said, 14 breaths per minute. Consistent. Don't rush it. Davis nodded and started. Ava moved to Noah's side and did something that stopped every person in that bay cold. She pressed her fingers along the back of his skull with a specific, deliberate pattern. Not the fumbling search of someone feeling for obvious damage, but the practiced, systematic assessment of someone who had done this in conditions far worse than this. In the dark, in the rain, with the sound of something much worse than ambulance sirens overhead. "There's a step deformity at the occiput," she said. "He has a posterior skull fracture. Neurosurgery needs to know that when they get on the line." She looked up. "Is neurology on the phone yet?" Marcus had the phone in his hand, looking at her with an expression she had no time to interpret. "They're on hold. Take them off hold." He did. What happened in Bay 4 in the next 22 minutes was not something anyone in that ER had a clean explanation for afterward. Ava spoke to the neurosurgeon on the phone with the kind of clinical precision that usually only existed between attendings. She described the mechanism of injury, the imaging. She wanted the specific sequence of interventions she had already begun, and why. The neurosurgeon, a man named Dr. Yun, who had been practicing for 15 years, asked her 3 questions. She answered all 3 correctly before he had finished asking them. He said, "Get him to CT, I'll meet you upstairs." Noah went to CT at 10:24. But while Noah was being stabilized, the other bays were deteriorating. Bay 1, the hemothorax patient, had responded to Dr. Solis's chest tube, but his pressure was dropping again. The crush injury patient in Bay 3 was throwing clots. The 2 patients who had come in the second wave, a pair of construction workers with polytrauma, were both becoming hemodynamically unstable in ways that weren't responding to fluid resuscitation the way they should have been. Patricia was moving between bays like a woman trying to hold a cracking dam together with her hands. She looked at Ava when she came out of Bay 4, and her expression said everything her voice didn't. "Tell me what you need," Ava said. "I need a surgeon," Patricia said. "I need 3 surgeons. I know, tell me which patient is closest to the edge." Patricia pointed at Bay 3. "She's throwing emboli. I think she's going to arrest." Ava was already moving. The woman in Bay 3 was named Diane, 47 years old. She had been crossing the bridge on foot when the collapse happened, and both her legs had been crushed under a concrete beam. The field tourniquet had saved her from bleeding out, but now the damaged tissue was releasing clots into her bloodstream, and her heart was showing it on the monitor. The rhythm was starting to look wrong in a specific, dangerous way. The resident at her bedside, a second-year named Chen, was staring at the monitor with the look of someone who understood exactly what they were seeing and exactly how little they knew how to stop it. "Her rate is up to 120, Chen said when Ava came in. "I think she's in AFib with VRR, Ava said, already reading the strip. "Cardiology. Not here yet. IV access, 2 PA. IVs, left AC and right AC. Push a cardizem bolus, 20 milligrams over 2 minutes. She looked at Chen directly. "Can you do that?" Chen hesitated. "I'd need an attending to order." "Get me an attending on the phone right now. I'll give the verbal order myself and you document it as given under emergency standing protocol." She met his eyes. "She does not have time for us to have this conversation twice." Chen made the call. The attending on the other end of the line was Dr. Wen, still 40 minutes out, driving as fast as he legally could. He asked Ava 2 questions. She answered them. He gave the order. Chen pushed the bolus. Diane's rhythm broke back into sinus 4 minutes later. And somewhere in the middle of all of this, somewhere between Bay 4 and Bay 3, between the child's fractured skull and the woman's clotting blood, between the phone calls and the orders and the precise, unhesitating movements of her hands, something in the room shifted. The nurses began looking at each other, not with panic, not with confusion, with something much more complicated than either of those things. There was a word for what Ava was doing, and it was not nursing. It was not even what most attendings did, because most attendings had learned their craft in hospitals and classrooms, in simulations and supervised rotations. What Ava was doing had a different texture to it, a different economy of movement. The way she assessed, decided, and acted had no wasted motion in it, no second guessing, no checking the reference, no moment of reaching back through memory to find the right answer. She already had the answer. She had always had the answer. The answers were stored somewhere in her body, the way reflexes are stored, not thought, not recalled, but simply there. Marcus pulled Patricia aside at 10:39. He kept his voice low. "Patricia, who is she?" "She's a nurse, 4 months in." "No," Marcus said. "No, she's not. I've been watching her for 30 minutes. She placed 2 central lines tonight. She called a herniation syndrome before we had imaging to confirm it. She managed a traumatic dysrhythmia with cardiology on the phone, and the cardiologist agreed with everything she said. Patricia, I trained under Dr. Clean for 3 years, and I couldn't do what she's doing." Patricia said nothing for a moment. Then she said, "Get Dr. Clean on the phone again. Tell him what's happening here tonight. All of it." At 10:47, 1 hour after the first ambulance had radioed in, the trauma bays at Mercy General held 7 patients who were alive. All 7. Noah was in CT stable with a neurosurgeon en route. Diane's heart rhythm had held. The hemothorax patient had been moved to the OR. The construction workers were responding to treatment. The final two patients brought in last had been triaged and managed and were both critical but no longer immediately dying. Patricia stood in the middle of the ER and looked at the board. She looked at the numbers. She looked at the times. Then she found Ava at the nurse's station, writing notes with the same quiet, methodical focus she brought to everything, and she stood in front of her for a long moment. Reyes, she said. Ava looked up. 7 patients, Patricia said. 1 hour. Yes. You want to tell me something, anything? Ava held her gaze. For a moment, something moved behind her eyes. Something that looked almost like relief and almost like grief and almost like the face of a person who has been carrying something very heavy for a very long time and has just been asked for the first time whether they need to put it down. Not tonight, Ava said. Patricia nodded slowly. She looked like she wanted to push. She looked like 31 years of nursing instinct were telling her to push. But she let it go. Go get some water. You've got more charting than I've ever seen one nurse generate in a single hour. Ava almost smiled. Almost. She was filling her water cup at the break room sink when the ER doors opened again. Not ambulances this time. 2 people walked in, a man and a woman, both in dark suits, both wearing badges on their belts. The man was tall, maybe 50, with gray at his temples and the kind of stillness in his face that came not from peace, but from long practice at concealing what he was thinking. The woman was younger, sharper-eyed, holding a folder that she kept close to her body. They went directly to the front desk. They showed their badges. They asked for the charge nurse, and the man said 4 words that the front desk clerk would repeat to every person she knew for the next 6 months. He said, "We're here for Reyes." Ava heard it from the break room. She stood very still for a moment. She looked down at the water cup in her hand. She set it carefully on the counter. And she breathed in the way a person breathes when they have known for a long time that a specific door was going to open and they have spent years preparing for it. And none of that preparation has made it any easier. She walked back out into the ER. The 2 agents turned when she appeared. The man's eyes found her immediately the way a person's eyes find something they have been looking for long enough that recognition is instant and involuntary. He said, "Ava Reyes." She said, "That's my name." The woman with the folder opened it, took out a single photograph, held it up. It was a military ID. The face in the photograph was younger, harder, different in a dozen small ways that years and necessity and a new life could account for. But the eyes were the same, the exact same eyes. The name on the ID was not Reyes. The man said very quietly, so that only she could hear him, "We need to talk about Operation Black Crest." And in the humming, exhausted, alive emergency room of Mercy General Hospital on a Thursday night in October, Ava Reyes stood very still and said nothing, and felt the floor she had been standing on for 4 years begin to tilt beneath her feet. The man's name was Special Agent Daniel Croft. He said it once quietly, the way people say things they don't expect to have to repeat. The woman beside him was Agent Sandra Voss. She hadn't said her name yet. She was still holding the folder, still holding the photograph, still watching Ava with the particular kind of attention that made the back of Ava's neck go cold in a way that had nothing to do with the hospital air conditioning. Patricia was standing 6 feet away. She had not moved since the badges came out. Marcus was at the nurse's station pretending to look at a chart. He was not looking at a chart. Croft said, "Is there somewhere we can speak privately?" Ava looked at him for a moment. Then she looked at the photograph in Voss's hand. The face in that photograph was hers, younger, stripped down, no softness in it anywhere, and the name printed beneath it belonged to a person who was supposed to be dead. "The family consultation room," Ava said. "Down the hall." She walked. They followed. Patricia watched them go. Then she turned to Marcus and said in a voice that was very low and very controlled, "Get Dr. Clean on the phone. Tell him to get here now. No more traffic excuses. Now." The consultation room was small. 3 chairs, a table, a box of tissues on the corner that nobody ever wanted to need. Ava sat down on one side. Croft sat across from her. Voss remained standing, which Ava recognized immediately as a deliberate choice. Keep one person in motion, keep the subject's eyes moving, keep them slightly off balance. She had learned that technique in a context that had nothing to do with law enforcement paperwork. She filed that observation away and kept her face neutral. Croft folded his hands on the table. "I'm going to be straightforward with you," he said. "We're not here to arrest you tonight." "That's reassuring," Ava said, "but I need you to understand that what happens in the next hour will determine whether that changes." Voss set the folder on the table and opened it. Inside were documents, photographs, a timeline printed on government letterhead that Ava recognized by its formatting before she read a single word of it. "Your name," Croft said. "According to the Arizona Nursing Board, the Social Security Administration, and the personnel file of this hospital is Ava Reyes, born September 14th, 1994. Raised in Tucson, nursing degree from the Maricopa Institute of Health Sciences, graduated 18 months ago." "That's correct," Ava said. "Except," Croft said, and he said the word with the careful precision of a man placing a very specific object on a very specific surface, "that none of those records existed before 4 years ago." Ava said nothing. "The Maricopa Institute has a transcript on file. Professors remember a student by that name. There are clinical, rotation records, evaluation forms, even a parking ticket from the campus lot dated 2 years ago." He paused. "Every single one of those documents was created. Very well created, I'll give you that. But created." Voss tapped the photograph. "Her name was Specialist Elena Vasquez, United States Army, 18 Delta Special Forces Medical Sergeant, deployed 3 times, twice to Iraq, once to Afghanistan." She paused. "Killed in action 14 months into her 3rd deployment, Operation Black Crest, March of 2020. The room was very quiet. Ava looked at the photograph for a long time. Something moved across her face, something that wasn't quite grief and wasn't quite anger and wasn't quite fear, but lived in the neighborhood of all 3. "Killed in action," she said finally. "That's what the record says," Croft said. "And what do you say?" He leaned forward slightly. "I say she's sitting across from me right now. And I say she just managed a mass casualty event in an emergency room with the clinical precision of someone who has treated traumatic injuries under active fire conditions. And I say I need to understand how that's possible and why and what it means." Ava looked at him. "You said you'd be straightforward." "I am." "Then let me be straightforward back." She leaned forward and matched his position exactly. 7 people are alive tonight. 7. One of them is an 8-year-old boy who would have herniated in the next 4 minutes if someone hadn't been in that bay who knew exactly what to do. I am the person who was in that bay, and you are sitting here with a folder full of paperwork asking me to account for myself when the only thing that happened tonight is that people lived who were going to die. She held his gaze. "So ask your question. Ask it directly. Stop building up to it." Croft was quiet for a moment. He looked at her with something that was almost respect and entirely calculation. "Are you Elena Vasquez?" he said, and Ava said nothing. The silence stretched out for 10 full seconds. Voss had gone very still. Even the ambient sound of the hospital beyond the door seemed to pull back as if the building itself was listening. Then Ava said, "What do you know about Operation Black Crest?" Croft's jaw tightened, just slightly, just enough. "Enough," he said. "That's not an answer. It's the answer you're getting right now." "Then we're going to be here a long time," Ava said, and she sat back in her chair with the practiced ease of someone who had been in interrogation rooms before, not as a nurse, not as a civilian, but as something else entirely. Outside the consultation room, the ER was rebuilding itself from the wreckage of the past hour. Patients had been moved. Blood had been cleaned. The board showed transfers and admissions and the slow-grinding administrative machinery of survival converting itself into paperwork. Dr. Clean had arrived. He was 53, silver-haired, the kind of physician who carried authority the way other people carried car keys, automatically without thinking about it. He had been head of trauma surgery at Mercy General for 11 years, and he had come through those doors at 11:04 with his coat still on and his face carrying the expression of a man who had been briefed on the way in and was not entirely sure he had been briefed accurately. He found Patricia immediately. "Tell me what happened, from the beginning." She told him. All of it. The 7 patients, the timeline, the specific interventions, the phone call to Dr. Yohn that had been described to her afterward by the neurosurgeon himself as the most coherent trauma handoff he had received from a floor nurse in 20 years of practice. She told him about the cardiac embolus, about the IO line, about the posterior skull fracture that Ava had identified by hand before imaging confirmed it. Clean listened without interrupting. When she finished, he said, "And she's in with the FBI right now." "Yes." "Since when? 40 minutes. He was quiet. Then he said, "Get me her personnel file." "Already printed," Patricia said and handed it to him. He read it standing up. He read it the way surgeons read things fast, systematic, already sorting for what mattered. Halfway through, something changed in his expression. He read one section twice. Then he looked up at Patricia. "Her clinical rotation supervisor," he said. "Dr. Franklin Adler, Phoenix." "Yes. I know Frank Adler. We trained together. We were residents at the same program in Baltimore." He looked back at the file. Frank retired 4 years ago. He has a degenerative retinal condition. He hasn't been able to practice or supervise in 3 years. He set the file down. He could not have supervised anyone's clinical rotations. Patricia looked at him. "Her file is wrong," Clean said. "Her file is something worse than wrong," Patricia said quietly. He looked toward the consultation room at the end of the hall. He looked at it for a long time. Then he said, "Is she in trouble? I genuinely do not know. Is she dangerous?" Patricia thought about 7 patients. She thought about a boy named Noah whose brain had been bleeding and who was now in imaging with a surgeon watching over him. She thought about Diane's heart rhythm breaking back into sinus on a monitor while everyone in the bay held their breath. "Not to us," she said. In the consultation room, the conversation had shifted. Croft had opened a second section of the folder. These documents were different, older, some of them with the particular texture of things that had been printed and filed and archived in systems that most people didn't know existed. The mission was a 9-man operation, he said. Special Forces Detachment attached to a classified intelligence unit operating in Kandahar province. The objective was the extraction of an asset who had been embedded in a local network for 14 months. He paused. The mission went wrong, an IED on the exfil route followed by a secondary ambush. 5 members of the unit were killed on scene. 3 were listed as missing in action and subsequently declared dead. 1, he tapped the photograph, was listed as killed in action based on witness accounts. Ava was watching him. Her face had gone very still, not the stillness of shock, the stillness of someone listening to a story they already know and measuring how much of it the other person has right. "The asset was recovered," Croft continued. "The mission technically succeeded, but the unit was gone, and the operation was classified at a level that meant the families were told the minimum required by law and nothing more." He looked up. 6 months later, a woman matching the physical description of Specialist Vasquez was identified on security footage at a bus station in Albuquerque. The analyst who flagged it was told she was mistaken. "But she wasn't," Ava said. "It wasn't a question." Croft said no, she wasn't. Voss spoke for the first time since they had sat down. Her voice was quieter than Ava had expected, less combative, more careful. "What we need to understand," she said, "is why. Not just for the record, for something else." She glanced at Croft, a look passed between them that Ava caught and cataloged. "There are people who want to know that Specialist Vasquez is alive, not to prosecute her, not to bring her back in, for another reason entirely." "What reason?" Ava said. Voss hesitated. "What reason?" Ava said again, and this time there was something in her voice that hadn't been there before, something quiet and very sharp like a blade being turned over in the dark. Voss looked at Croft. He gave a small nod. 2 of the men listed as missing in action from Operation Black Crest," Voss said. "We have reason to believe they are alive." The air in the room changed. Ava's hands, which had been still on the table, moved, just slightly, just enough that Voss noticed and made a note of it. "Which 2?" Ava said. Her voice was completely flat. "That's what we need your help to determine," Croft said. Ava looked at him. Something was happening in her eyes that was very hard to read, a rapid, invisible processing of information that looked from the outside like stillness, but was actually the opposite of stillness. She was running calculations. She was assessing and deciding and moving through contingencies with the speed of someone who had been trained to do exactly this exactly these kinds of conditions. You didn't come here because you found me, she said slowly. Croft said nothing. You came here because something happened. Something recent. Something that made finding me urgent. She leaned forward. What happened? Another silence. Longer this time. Voss said very quietly, 4 days ago a man was brought into a trauma center in El Paso. No ID, severe injuries consistent with torture. He was unconscious for 36 hours. When he woke up, the first thing he said, the only thing he said for 12 hours was a name. She looked at Ava. He said, Elena. The word landed in the room like a stone dropped from a great height. Ava was absolutely motionless. We have photographs, Voss said. She reached into the folder and slid a photograph across the table face down. I need to warn you that these are difficult images. The injuries are unbearable. Show me, Ava said. Voss turned the photograph over. Ava looked at it for exactly 3 seconds, then she looked away. She looked at the wall. She pressed her lips together. She breathed in through her nose slowly, deliberately, the way a person breathes when they are managing something that would otherwise come out of them in a way they cannot afford. His name, she said, and her voice was the steadiest it had been all night, which was somehow the most frightening thing in the room, is Sergeant First Class Danny Reyes. Voss and Croft both went very still. Danny Reyes, Ava said. He was my team sergeant. He was the best soldier I ever served with. And the last time I saw him, he was pulling me out of a burning vehicle on a road outside Kandahar and telling me to run. Telling me to run and not stop. She looked back at the photograph. I ran. I didn't stop. Her voice didn't break. It just went very thin. I have been running ever since. Croft said, he's alive. I can see that. He's asking for you. I can see that too. Then you understand why we're here. Ava looked at him for a long moment. 4 years of silence. 4 years of a new name, a new life, a new face built out of quieter habits and softer edges of becoming someone who worked in a hospital and saved lives in the approved, documented, legally sanctioned way. 4 years of being Ava Reyes. 4 years of almost believing it. What does he know, she asked, about what's still out there? Croft said, that's the question we need you to help us answer. That's not an answer. No, he said, it's not. She looked at the photograph one more time. Then she closed her eyes for exactly 2 seconds, not from weakness, but from the specific deliberate choice of a person deciding something, and when she opened them, something had settled in her expression. Something had resolved. I'm going to need to finish my shift, she said. Croft blinked. I'm sorry. I have patients. I have charts. I have a boy upstairs whose surgery I need to be updated on. She stood up. You want my cooperation. You're going to get it, but I am not walking out of this hospital tonight, leaving my patients half-documented and my colleagues short-staffed because 2 agents decided the paperwork was more urgent than the people. She looked at him steadily. You've waited 4 years to find me. You can wait 4 more hours. Croft looked at Voss. Voss looked at Ava. And then something unexpected happened. Voss almost smiled. It was small, it was brief, it was gone before it fully arrived. But it was there. 4 hours, Croft said. 4 hours, Ava confirmed. She walked to the door. Her hand was on the handle when Croft said behind her, Vasquez. She stopped. She had not heard that name out loud in 4 years. It moved through her like something physical, like the first cold water after a long desert crossing. She didn't turn around. He kept asking for you, Croft said, every time he woke up. In the first 12 hours before he would talk to us, before he would tell us anything, he just kept saying your name. Ava stood at the door for 1 more second. Her hand tightened on the handle. Then she walked back out into the ER. Marcus saw her first. He watched her come out of the consultation room, and he watched her face, and he tried to read it and failed completely. Whatever was in her expression was too complicated and too controlled for him to parse in a single look. She walked back to the nurse's station the way she walked everywhere, direct, unhurried, precisely calibrated. And she picked up the chart she had been writing in before the world turned over, and she started writing again. He walked over slowly. He stood beside her for a moment. She didn't look up. Are you okay? He asked. She wrote 2 more lines before she answered. I need Noah's updated imaging results when they come down from CT. And I need someone to check in on the patient in Bay 3, Diane. Her rhythm was stable, but I want a follow-up strip in the next 30 minutes. Ava, she looked up. Marcus had the expression of someone who wanted very much to ask a question and understood very clearly that now was not the time. He was young, 26, maybe 27, and he was good at his job in the careful textbook way that school prepares people to be good at things. He had none of her specific history, none of whatever it was that lived in her hands and her mind and her reflexes. But he had good instincts. And right now, his instincts were telling him that the woman standing in front of him had just been through something in that room that was bigger than a nursing shift and bigger than 7 trauma patients and bigger than 2 FBI badges, and that she was holding it together through a combination of professionalism and sheer force of will that he found both impressive and quietly heartbreaking. The strip in 30 minutes, he said. I've got it. Thank you, Ava said, and she meant it. She meant it in a way that went further than the words. She went back to writing. At the other end of the nurse's station, behind the glass partition that separated the administrative area from the floor, Dr. Richard Harmon had arrived. He had not come in through the ambulance bay. He had come in through the administrative entrance, which was the entrance that people used when they wanted to be seen by administration before they were seen by anyone else. He was still in his street clothes. He had not been called in for the trauma event, had not even been notified until 40 minutes after it was over, and his face carried the specific expression of a man who had been handed information he did not like and had spent the drive over deciding what to do about it. Harmon was the chief of the Department of Medicine. He had no direct authority over the trauma bay. He had indirect authority over everything. He found Patricia within 2 minutes. I need the incident report, he said. Everything that happened tonight. Every order given, every intervention performed, every medication administered. He held her gaze, particularly anything that was performed without attending authorization. Patricia looked at him. Dr. Harmon, 7 patients survived tonight. 7 patients who were treated by a first-year nurse operating outside her scope of practice. 7 patients who are alive? Patricia said again, because she felt strongly that this point deserved to be made more than once. That is not the legal standard, Harmon said. The legal standard is whether proper protocols were followed. The legal standard is whether an unlicensed individual made medical decisions that could have resulted in harm. The outcome, he said the word like it was something distasteful, does not retroactively authorize the process. Patricia stared at him. She had worked in this hospital for 31 years. She had seen administrators come and go, had seen policies change and budgets cut, and politics move through the building like weather systems. She had never not once stood in front of a senior physician and felt the specific nauseating clarity of knowing that a person in a position of power was about to try to hurt someone for doing the right thing. The incident report, Harmon said again. I'll get it to you by morning, Patricia said. Her voice was perfectly even. He held her gaze for another moment. Then he walked away. Patricia watched him go. She turned back to the floor. She looked at Ava, who was still at the nurse's station, still writing, still holding herself together with both hands. She looked at the board where 7 names were listed under 7 room numbers, all of them alive. Then she walked to the supply room, closed the door behind her, and stood alone for 45 seconds breathing. When she came back out, her face was composed, her hands were steady. She had been doing this for 31 years. She knew how to hold the line. But as she walked back onto the floor, she also knew, with the particular certainty that 31 years gives a person, that tonight was not the end of anything. Tonight was the beginning. The clock on the nurse's station wall read 11:48 when Dr. Clean finally walked onto the floor. He didn't announce himself. He didn't need to. The staff felt him, the way a room feels a change in pressure, not loud, not dramatic, just suddenly different in a way that made everyone straighten slightly without knowing why. He had that quality. 30 years of trauma surgery will either break a person or build them into something that other people instinctively orient toward, the way a compass needle finds north. He found Ava at the medication cart. He stood beside her for a moment without speaking. She was pulling a chart, cross-referencing a dosage, moving with the same quiet efficiency she had maintained for the past 40 minutes since walking out of that consultation room. She had not slowed down. She had not made a single error. She had in fact caught a transcription mistake in a medication order that a resident had entered incorrectly and corrected it before it reached the patient, which was the kind of thing that good nurses did without fanfare and without expectation of acknowledgement. Reyes, Clean said. She looked up. He studied her face for a moment. Then he said, "Walk with me." They walked to the window at the end of the corridor. Not the consultation room, not an office. Just the hallway with the low hum of the hospital around them and the city dark and glittering beyond the glass. "I spoke to Frank Adler tonight," Clean said. He kept his voice low, matter-of-fact, the way he delivered difficult diagnoses, not cruelly, not gently, but honestly. "He confirmed what I suspected. He didn't supervise your rotations. He's never met you." Ava held his gaze. She didn't flinch. "I know. Your nursing degree," he said, "your transcript. Your entire history before 4 years ago." "I know," she said again. He was quiet for a moment, a long moment. Outside, an ambulance moved through the street below, lights on, but no siren. The way ambulances moved when they were transporting someone who was already stable, already past the worst of it. "Dr. Young called me," Clean said. "From upstairs, about the boy." He paused. He said the nurse who handed off the case to him described the injury mechanism and clinical presentation with a precision he would expect from a trauma fellow in their final year. He said the interventions that had already been performed when he arrived were exactly what he would have ordered. He looked at her. "He asked me who trained you." "What did you tell him?" "I told him I'd get back to him on that." Clean folded his arms. "So, what do I tell him?" Ava looked out the window. The city sat there indifferent and vast, doing what cities do at midnight, moving, breathing, containing its millions of small, private urgencies without any awareness of this one. "Tell him she learned from the best teachers she ever had," Ava said, "and that most of them are dead." Clean absorbed that. He was not a man who rattled easily. He had held open chests with his hands, had made decisions in seconds that other people agonized over. For hours had told hundreds of families the worst news of their lives. He was not rattled now, but something in his expression shifted, a recognition, a recalibration. "The FBI," he said. "Yes." "Are you going to be arrested?" "No." "Are you sure?" She looked back at him. "I'm sure." He held her gaze for another moment. Then very quietly he said, "Are you safe?" The question was so simple and so unexpected that Ava almost didn't have an answer for it. Nobody had asked her that in 4 years. Nobody had even come close. People had asked her practical questions. Are you competent? Are you qualified? Are you licensed? Are your credentials in order? Nobody had looked at her the way Clean was looking at her right now, which was the way a person looks at another person when they actually want to know the answer. "I don't know yet," she said honestly. He nodded once, like that was enough. "Then let's get you through the rest of this shift," he said, "one thing at a time." It was a small thing to say. It was also exactly the right thing. 12:04 Dr. Harmon did not go home. This was the first sign, if anyone had been watching carefully enough, that something was moving beneath the surface of the night that had nothing to do with administrative procedure. Department chiefs did not stay at the hospital after midnight to review incident reports. They had offices and assistants and morning meetings for that. If Richard Harmon was still in the building at midnight in his street clothes, in the administrative wing, with his door closed and his phone in his hand, then what he was doing was not paperwork. What he was doing was making calls. The first call lasted 4 minutes. The second lasted 11. The third was barely 30 seconds. But when it ended, Harmon sat very still for a long moment before he put his phone down. Then he picked it up again and called one more number. The person who answered said, "Tell me it's contained." Harmon said, "It's not." A silence. Then how bad? "The FBI is already here." Another silence, longer. "Does she know?" the voice said. "I don't know what she knows." "Find out," the voice said. "And Richard, do not let her leave that building voluntarily. Do you understand me? Not until we know what she told them." The line went dead. Harmon sat in his office for another minute, perfectly still. Then he stood up, straightened his jacket, and walked back out onto the floor. Ava felt it before she saw it. There was a particular quality to being watched by someone who did not want you to know they were watching, a pressure, almost a change in the texture of the air around you, that her body had been trained over years to recognize and respond to. She felt it at 12:11, standing at the nurse's station, and she looked up without appearing to look up, and she found Harmon at the far end of the corridor. He was not looking at her, which was exactly why she knew he was. She went back to her chart. She finished the note she was writing. She pulled her phone from her scrub pocket, the personal phone, not the hospital one, and she sent a text message. 3 words. Then she put it away. Croft's phone buzzed in the consultation room where he and Voss had been reviewing documents for the past hour. He looked at the message. It said, "Someone else here." He showed it to Voss. She read it. Her eyes went to the door. "How does she know?" Voss said. "She's trained to know," Croft said. He stood up. 12:19 a.m. Harmon was standing near the medication cart when Croft came out of the consultation room and walked directly toward him with the kind of stride that announces itself as federal before the badge even comes out. Harmon turned. He saw Croft. He saw the badge. And his face did something that Croft had seen 100 times in 100 different people. It tried to compose itself a full half-second too late. "Dr. Harmon," Croft said. "Yes." Special Agent Daniel Croft, FBI. He didn't extend his hand. "I understand you're the chief of medicine here." "Department chair, Barnes," Harmon said. The correction was automatic, reflexive, the response of a man accustomed to precision in matters of hierarchy. "Right. Do you have a moment?" It was not really a question. They went into the administrator's office because it was the nearest private space. Voss joined them. She closed the door. Harmon looked between them with an expression that was working very hard to look like mild inconvenience and achieving something closer to controlled alarm. "I assume this is about the incident tonight," Harmon said. "The nurse, her credentials." "Among other things," Croft said. "How long have you known about the credential issue?" "I became aware of it tonight when—" "That's not what I asked," Croft said. "I asked how long you've known." Harmon stopped. The room was very quiet. "I want to be clear about something," Croft said, and his voice had shifted. It had gone from conversational to something else. Something with weight in it. "We have been investigating the identity of your employee for approximately 6 weeks. During that investigation, we reviewed communications logs associated with this hospital's administrative network." He paused. "We found some interesting things." Harmon's left hand resting on the desk moved. The fingers curled inward just slightly. Voss noted it. "What kind of things?" Harmon said. His voice was still steady. His hand was not. "The kind that suggests you were contacted approximately 3 months ago by a party asking whether you had a nurse by a certain description on your staff. The kind that suggests you confirmed it. The kind that suggests you were asked to monitor her and report if anything unusual occurred." Croft leaned forward. "And the kind that suggests that tonight, after a very unusual occurrence, you made 3 phone calls in the space of 20 minutes from your personal cell. 2 to numbers we know, 1 to a number we're very interested in." Harmon said nothing. "Who asked you to watch her?" Croft said. "Nothing." "Dr. Harmon, I need you to understand that the conversation you had on that last phone call tonight, the one that lasted 30 seconds, puts you in a position that is significantly more serious than being a witness." He held the man's gaze. "So I am going to have to ask you one more time, and I need you to think very carefully before you answer, because what you say in the next 30 seconds will determine which side of this you end up on." Harmon looked at the table. He looked at his own hands. He looked like a man who had made a series of choices over a period of time that had each seemed individually manageable, and who was now sitting in the room where all of those choices had arrived at once to introduce themselves. "His name," Harmon said finally very quietly, "is Mercer. I don't know his first name. I don't know who he works for. He contacted me through the hospital's research liaison office. He said it was a national security matter. He said I was helping to locate someone who posed a security risk." He stopped. His jaw worked for a moment. "He said it was the right thing to do." "And the phone call tonight," Croft said, "the 30-second one, what did Mercer say?" Harmon looked up. His face had the expression of a man who had just understood completely and finally that he had been used. He said not to let her leave the building. The text from Croft came through to Ava's phone at 12:31. "Stay visible. Don't go anywhere alone." She read it. She put her phone away. She walked to the break room, poured herself a cup of coffee she didn't intend to drink, and stood at the counter for a moment with both hands wrapped around the cup and her eyes on the middle distance. Marcus appeared in the doorway. He had the look of someone who had been watching the night get stranger and stranger and had made the private decision to stay close to the person at the center of it, not out of nosiness, but out of the instinct that sometimes the most useful thing you can do is simply refuse to leave. Diane's strip came back, he said. Rhythms holding. BP's 110/70. Good, Ava said. He came into the break room. He poured his own coffee. He stood on the other side of the counter, and for a moment they were just two nurses in a break room at midnight, which was the most ordinary thing in the world. You know what I keep thinking about, Marcus said. What? That boy, Noah. He looked at his coffee. When they brought him in, I looked at his face and I knew what I was supposed to do. I knew the protocol. But there was this second where he stopped. You didn't have that second. You walked in and you were just already there, already ahead of it. He looked up at her. What does that feel like to know like that? Ava was quiet for a moment. Heavy, she said finally. It feels heavy. Marcus nodded slowly, like that made a kind of sense he hadn't expected. Is he going to be okay? He asked. Noah. Yun is good, Ava said. He's one of the best I've seen. She caught herself, recalibrated. From what I've heard of him. Marcus looked at her. He almost said something. He chose not to. I'll go check on Bay 3, he said, and he left her with her coffee in the particular silence of a person standing in a room that is too small for everything they are carrying. 1247, Apon Croft found her there. He came into the break room and closed the door and sat down across from her at the small table. And this time there was no folder, no photograph, no official posture. He looked tired in the way investigators look tired when a case has been moving for a long time and has just taken a turn that changes its shape entirely. Harmon, he said. He was placed here. Ava looked at him. How long? He made contact with someone named Mercer approximately 3 months ago. We believe Mercer works for a private intelligence contractor with government adjacency, meaning they have enough official cover to make requests that look legitimate. He paused. They were looking for you. I know. You knew they were looking. I assumed, she said. After long enough, I assumed. People like Mercer don't leave threads loose forever. She turned her coffee cup in her hands. What I didn't know was how close they were. They knew you were here before tonight, Croft said. The question is why they waited. Ava looked at him steadily. They were waiting to see if Danny surfaced. Croft was very still. Think about it, she said. If they wanted to find me, they had enough to move on months ago. Medical records, biometrics, whatever Harmon gave them. But they didn't move, because what they actually want is not me. She leaned forward. What they want is whatever Danny was carrying when he got out. Whatever he knows about what actually happened on that road outside Kandahar. She paused. And they thought the fastest way to find him was to find me first, and wait for me to lead them to him. Croft said nothing for a long moment. Then he said, You've had 4 years to think about this. I've had 4 years to think about a lot of things. Then think about this, he said. If Mercer's people know you're here, and they know we're here, then the window on this conversation is closing. Because the moment they calculate that you've told us what you know, you stop being useful as bait and start being a liability. The word landed the way it was meant to. I understand what a liability means to people like Mercer, Ava said. I know you do. So what are you offering? Croft looked at her steadily. Protection, testimony cooperation, and he held her gaze. Danny, we can get you to El Paso. Tonight if you agree to work with us. He's conscious now. He's been asking. And we believe he has information that will take apart whatever Mercer is running from the inside. They might thoughts. He paused. But we need you, not because of what you know, because of who you are to him. He won't talk to us. He'll talk to you. Ava was quiet. Outside the break room, the ER moved through its midnight rhythms. Someone was being admitted. A monitor alarmed and was silenced. A cart rolled past the door. The ordinary machinery of a place where people came to survive. She thought about Danny Reyes on a road outside Kandahar, pulling her out of smoke and fire, telling her to run. She thought about the look on his face in that moment. Not fear, not desperation, but the absolute steady certainty of a man who had decided what mattered and was acting accordingly. She had run because, so he told her to. She had kept running because she didn't know how to stop. If I go with you, she said, What happens to my patients? Croft blinked. He hadn't expected that question. Not then. Your patients, he said. The 7 people who came in tonight. Noah, Diane, the others. She met his eyes. What happens to their follow-up care? Who checks on them tomorrow? He stared at her for a moment. Then very quietly he said, I'll make sure the hospital is covered. That's not an answer, Reyes. That is not an answer. He looked at her for a long moment, and what he saw in her face was not stubbornness, not deflection, not a negotiating tactic. It was the simplest thing in the world, a person who had built a life around caring for other people and refused to leave that life behind carelessly even now. Even in the middle of this. I will personally ensure, he said slowly and deliberately, that Dr. Clean is briefed on every patient's status before we leave, and that your nursing notes are complete and transferred. He paused. Is that enough? She considered it. Yes, she said, that's enough. She stood up. She set her coffee cup down. She straightened her scrub top in the automatic, unconscious way of someone who keeps their hands useful at all times. I need 30 minutes, she said, to finish my charts and say goodbye to my team. 30 minutes, Croft said. She nodded and walked to the door. Her hand was on it when he said, Can I ask you something? She stopped, but didn't turn. 4 years, he said. You could have gone anywhere, disappeared completely. Lived somewhere with no hospitals, no trauma bays, no emergencies to walk into. You chose this. He paused. Why? She stood there for a moment. The door was right in front of her. Because this is the only thing I know how to do, she said, and I decided a long time ago that I wasn't going to let what happened to me make me into someone who stops doing it. She pushed the door open and walked back onto the floor. 1:03 a.m., Patricia saw her coming. There was something different in Ava's walk, not slower, not heavier, but more deliberate. The walk of someone who has made a decision and is now moving toward its consequences with full awareness of what they are. Patricia had seen that walk before. She had seen it on patients who had decided to stop treatment. She had seen it on doctors delivering news they had been dreading. She had never expected to see it on a nurse 4 months into her first job. She met Ava at the nurse's station. She didn't ask, she just looked. I have to go, Ava said. Patricia said nothing. Not because I want to. Ava held her gaze. There's something I have to do, something I should have done a long time ago. She paused. I finished every chart. Bay 3 is stable. Noah's imaging showed a clean surgical field. Ewan is pleased. The construction workers in 5 and 6 are both upgraded to serious but stable. Everything is documented. Patricia still said nothing. Patricia. Ava's voice softened just slightly, just enough. I need you to know that this job was real. Every shift, every patient. She stopped, swallowed. I need you to know I didn't fake that. Patricia looked at her for a long moment. Her eyes were doing something complicated that her face was working hard to contain. Then she said in the driest possible voice, the voice of a woman who had held this floor together through 31 years of impossible nights, if you faked caring about your patients, Reyes, you deserve an Academy Award. Ava almost laughed. It was the closest thing to a laugh she had managed in 4 hours. Go, Patricia said, and then very quietly, so that only Ava could hear it, come back. It wasn't a request. It was something older than a request. It was the way people talk to each other when they mean something they don't have a proper word for. Ava nodded once. She went to find Marcus. She found him at the medication cart exactly where she'd found him 100 times on 100 ordinary shifts, doing the careful and unglamorous work that kept people alive in the hours when no one was saving anyone dramatically, just maintaining, just holding, just being present and competent and there. Noah's going to be okay, she told him. He looked up. He read her face. You're leaving. Yes, he looked like he wanted to ask why. He looked like he had 10 questions lined up behind that one. He let all of them go. Tell me one thing, he said, before you go. If I can. All those things you knew tonight, all of it. He looked at her. Was it worth it? Whatever it cost you to know all of that, was it worth it? Ava thought about a road in Kandahar. She thought about smoke and fire and Danny Reyes's hands pulling her out. She thought about 4 years of being Ava Reyes in a world that had no record of Elena Vasquez. She thought about 7 people who were alive right now in beds above and around her breathing because she had been standing in this particular place on this particular night. Ask me that again in a few days, she said. I think my answer is going to change. She squeezed his arm once briefly and walked away. At 1:14 a.m., Ava Reyes walked through the ambulance bay doors of Mercy General Hospital with Special Agent Daniel Croft on her left and Special Agent Sandra Voss on her right. The night air was cold and immediate after the recycled warmth of the ER. She stopped for one breath, just one, and looked up at the building. Somewhere above her, 7 people were sleeping toward survival. A boy named Noah was in a recovery room with a surgeon who had called her the most competent field assessment he had ever received. A woman named Diane had a heart that was beating steadily inside a body that had almost quit. Ava breathed in the cold air. Then she got in the car. And for the first time in 4 years, she was moving towards something instead of away from it, and the difference was so complete and so enormous that she pressed her hand flat against her chest for a moment, feeling her own heartbeat, reminding herself that she was alive, that this was real, that whatever came next was worth walking into. The car pulled out of the parking lot. The hospital disappeared behind them. The city opened up ahead. The drive to the airfield took 23 minutes. Nobody spoke for the first 10. Croft drove. Voss sat in the passenger seat with her phone in her hand, cycling through messages that came in steadily enough to suggest that whatever was moving on the other end of this operation was moving fast. Ava sat in the back and watched the city dissolve into highway, and the highway dissolve into the flat, dark geography of the outskirts. And she let herself feel the strangeness of it, the specific disorientation of a life that has been one thing for 4 years and is now, in the span of a single shift, becoming something else entirely. She had left her scrubs on. She had not had time to change. She was still wearing her hospital ID clipped to her chest pocket, the one that said Ava Reyes RN in block letters above her photograph. She looked down at it once and then looked away. Voss turned around in her seat. There are things you should know before we land in El Paso. Tell me, Ava said. Danny Reyes has been conscious and communicative for approximately 18 hours. In that time, he has spoken to 3 different federal agents, 2 physicians, and a trauma counselor. He has given his name, his service number, and a statement that he was held for approximately 11 months before escaping. She paused. That is everything he has voluntarily disclosed. And everything else? He stopped talking, completely. The moment they pushed him beyond his statement, he went silent and requested repeatedly to speak to someone named Elena. Voss held her gaze. We believe he has information about the third man. Ava's jaw tightened. The third man from Black Crest. Yes. You said 2 survivors earlier. We said 2, Croft said from the front, because that's what we confirmed. Danny Reyes is in El Paso. And a second individual we identified 6 weeks ago through financial forensics, a series of cash transactions in 3 states that matched a pattern consistent with someone running a ghost life. He paused. That individual's name is Sergeant Marcus Webb. He was your unit's communications specialist. Ava closed her eyes for exactly 2 seconds. When she opened them, they were very bright and very steady. Marcus is alive, she said. Not a question, a fact she was picking up and turning over, testing its weight. We believe so, Voss said. We haven't located him physically. But the financial trail went cold 8 days ago, which is either because he made us and ran, or because something happened to him. She kept her voice clinical, the way people keep their voices clinical when they are delivering information they know is not clinical at all. Danny knows where Marcus was. We think that's what he won't tell us. And we think he won't tell us because he doesn't trust us. He shouldn't trust you, Ava said simply. Croft glanced at her in the rearview mirror. That's a complicated position for someone sitting in our car. I'm not in your car because I trust you, Ava said. I'm in your car because Danny asked for me, and Marcus might be in danger, and those are the only 2 reasons I need. She met Croft's eyes in the mirror. Do you understand the difference? He held her gaze for a moment. Yes, he said, I do. The airfield was small, a regional facility used for charter flights and government transfers, the kind of place that existed in the functional margins of the official world. A plane was waiting, not military but not quite civilian either. The kind of aircraft that belonged to the category of things that were technically one thing and practically another. They boarded at 1:52 a.m. The flight to El Paso was 2 hours and 14 minutes. 2:08 a.m. Somewhere in that flight, in the particular suspended reality of being between places and between identities, Ava Reyes allowed herself to remember. She did not do this often. She had built her 4 years of civilian life in part by constructing very specific walls around very specific memories, the way a house in a flood zone is built with barriers, not to pretend the water doesn't exist, but to keep it from coming through the foundation. She knew the water was there. She had always known it was there. She had just been very careful about which doors she opened and when. Now she opened one. The road outside Kandahar had been their third exfil attempt. The first two had been compromised at the root level. Not bad intelligence, but intelligence that had been accurate when it was gathered and wrong. By the time they moved, which was the particular cruelty of operating in environments where the ground shifted faster than the maps. By the third attempt, the unit had been on the objective for 4 hours longer than planned. People were tired, the asset was deteriorating, and the IED was on a stretch of road that had been swept 12 hours earlier and cleared. 12 hours was a long time. The blast took out the lead vehicle instantly. Ava had been in the second vehicle, 8 meters behind. The pressure wave alone had been enough to throw her sideways, and the secondary ambush had started before the ringing in her ears had cleared. She remembered fragments after that, not a continuous narrative, but a series of images and sensations with gaps in between, like a film where every third frame has been cut. Danny's voice. Danny's hands. Smoke so thick it had texture. The sound of a radio that had stopped broadcasting anything useful. And Danny saying very clearly, very close to her ear, Elena, listen to me. You have to go. You go north and you don't stop. Do you hear me? You don't stop. She had gone north. She had not stopped. She pressed 2 fingers against the inside of her wrist, now feeling her own pulse, grounding herself in the present tense. The plane hummed around her. Croft was reading something on his tablet. Voss had her eyes closed, though Ava didn't think she was sleeping. 4 years. Danny had survived 4 years of whatever had been done to him, in whatever place they had held him, and the first name out of his mouth had been hers. She thought about that and felt something move through her chest that was too large and too complex to be called a single emotion. It was grief and relief and love and guilt all happening at the same time, which was the most honest thing she had felt in a very long while. She straightened in her seat. She put it back behind the wall. She needed to be clear when she landed. She could not afford anything but clarity right now. Croft, she said. He looked up from his tablet. When we get to El Paso, before I go in to see Danny. She held his gaze. I need you to tell me everything you know about Mercer. Not the summary, everything. He looked at her for a moment. Then he closed the tablet. All right, he said. Everything. 3:31 a.m. The trauma center in El Paso was a different world from Mercy General in the way that all hospitals are simultaneously the same world and completely different ones. Same antiseptic air, same low-frequency hum of machinery, keeping people alive. Different faces, different names on the boards, different particular arrangement of corridors and stations, and the invisible social geography that every hospital develops around itself like a second architecture. They came in through a side entrance. A man in a dark jacket met them at the door, mid-40s, the kind of build that suggested he had been fit in a specific trained way before time and desk work had softened the edges. He looked at Croft, then at Ava, and his expression registered something that might have been surprise or might have been the managed version of surprise that people in his line of work permitted themselves. She came, he said. She came, Croft confirmed. The man extended his hand to Ava. Agent Garrett, I'm the case lead on the ground here. He paused. He's been awake for the last 2 hours. He asked about you 4 times. Ava shook his hand. What's his status? Medical. Garrett looked at her with a slight recalibration in his expression. The shift that happened when people realized they were talking to someone who wanted clinical information and knew what to do with it. He had bilateral rib fractures, 4 on the right and 3 on the left. A partial pneumothorax on the right that was addressed on arrival. Evidence of prior injuries that had healed without proper treatment, a left radius fracture, at least 1 vertebral compression. Malnutrition markers that suggest sustained inadequate nutrition over a period of months. He paused. His attending described him as remarkably functional, given what his body has been through. Danny would be, Ava said quietly. The psychological picture is more complicated, Garrett continued. He's alert-oriented and entirely coherent, But he has, in the clinical team's assessment, constructed very deliberate boundaries around what he will discuss and what he won't. He's not dissociating. He's not in crisis. He's making a conscious, strategic decision about information disclosure. He looked at her, which again is apparently consistent with his training. It is, Ava said. They prepped us for you, Croft told Garrett. Mercer may have assets who know we located her. We need to move carefully. Garrett's jaw tightened. Understood. We've got additional security on the floor. 2 agents outside his room, 2 at each entrance. He looked at Ava. Are you ready? She had been ready for 4 years. She had been ready since the moment she stopped running and understood in the bone-deep way that trained people understand things that the running was never going to be permanent, that there was going to be a day when she had to turn around and face the direction she'd come from. Yes, she said. The corridor to his room felt longer than it was. Ava was aware of every step. She was aware of Croft behind her and the agent at the door ahead of her and the particular quality of the silence in this part of the hospital, which was the silence of a secure floor. No families waiting, no ambient noise of ordinary patient life, just the careful hush of a place being closely watched. The agent at the door stepped aside. She pushed it open and went in. 3:44 a.m. Danny Reyes was sitting up. He had not been lying down when she came in. He was sitting up against the raised head of the bed, with his arms at his sides and his eyes on the door, which meant he had been expecting her, which meant he had heard the footsteps in the corridor and known the specific rhythm of them. His face was older. 4 years and whatever had happened in between had put things in it that hadn't been there before. Lines at the corners of his eyes, a particular set to his jaw, a density in his expression that was the accumulation of a great deal of experience compressed into a frame that had once carried it more lightly. His left arm was in a soft brace. There was a healing laceration above his right eyebrow. He looked at her for a long moment. Then he said, "You cut your hair." Ava stood in the doorway. She felt her throat close, not from sadness, not precisely, but from the impact of him being real, of him being here and alive, and saying something as ordinary as that, as if for 4 years had been a weekend and they were meeting at the end of it. She walked in. She let the door close behind her. She pulled the chair to his bedside and sat down and looked at him directly and said, "You look terrible." "I've looked worse," he said. "When Fallujah." "That doesn't count. You were 23 in Fallujah." Something moved across his face that was not quite a smile, but was the architecture of one, the suggestion of it, the muscle memory of it. It was the best thing she had seen in 4 years. She felt it in her chest like a physical impact. "Elena," he said. "Ava," she said automatically. Then she stopped. She looked at him, and she said more quietly, "Both. I'm both." He nodded. He seemed to understand what that meant in a way that would have given anyone else an explanation. "How bad is it?" he said, "outside this room. How bad has it gotten?" "Mercer has assets at my hospital. He had the department chief monitoring me for 3 months." She held his gaze. "He knows the FBI found me. He knows I came here. He's going to move." Danny processed this with the particular speed of someone whose threat assessment had been running continuously for a very long time. "Then we don't have much time." "No." He looked at her for another moment. Then he looked at the door. He looked back at her. "Marcus," he said, "I know. Croft told me they tracked him financially." Then the trail went cold. She leaned forward. "Danny, where is he?" Danny closed his eyes for a moment. When he opened them, there was something in them that was heavier than anything else she had seen that night, which was saying a great deal. "Marcus didn't run," he said. "I made contact with him 6 weeks ago. After I got out of the place, they held me. Before I made it to El Paso." He paused. "I told him to stay where he was and not to move and not to contact anyone because I had gotten hold of something and I needed him to be safe while I figured out how to use it." "What did you get hold of?" Ava said. Danny looked at her steadily. "Documentation," he said, "from inside the place they held me. Names, dates, operational records going back to before Black Crest. Records that prove that Operation Black Crest didn't fail, Elena. It didn't fail by accident." He held her gaze. It was deliberately compromised, from the inside, by people with government clearance who were working with Mercer's organization. They wanted the asset we were extracting. They wanted him dead before he could talk, and they wanted our unit gone because we knew too much about why. His voice was completely level. "They killed our team. And then they buried us. The room was very still. Ava sat with it. She sat with the weight of it, which was the weight of 4 years of running from a truth that she had never fully allowed herself to articulate because some truths are too large and too wrong to be held directly. And so a person carries them sideways, carries them in the body, in the reflexes, in the decision to become a nurse in an emergency room and save strangers because saving strangers is the thing that makes the not saving bearable. Where is the documentation, she said. Marcus has it, Danny said. I sent it to him through a dead draw 6 weeks ago. Physical copies and an encrypted drive. He paused. And then I was picked up by Mercer's people 3 days later, before I could reach him. His jaw tightened. They held me for 8 days. They wanted to know if I had made copies. They wanted to know if I had contacted anyone. He looked at her. I didn't tell them about Marcus. Or me. Or you, Ava breathed. Where is Marcus? Danny told her. An address in a town called Presidio, 80 miles from El Paso, right on the Texas-Mexico border. A small house rented cash, the kind of place that didn't ask questions. Ava stood up immediately. Wait, Danny said. She stopped. Mercer's people know I escaped. They know I was brought here. They know the FBI has me. He met her eyes. They will have calculated that I told someone where Marcus is. It's what they would do. Which means Presidio is not safe right now. It may not have been safe for the last 12 hours. Ava turned to the door. Croft, she said loud enough to carry. The door opened in 4 seconds. Croft came in. He read the room immediately, read Ava's face, read Danny's position, read the particular electricity in the air of 2 people who have just exchanged something significant. Presidio, Ava said. We need to move now. Tell me, Croft said. She told him, all of it. 70 seconds complete, no wasted words. The documentation, Marcus Webb, the address, the timeline, Mercer's likely calculation. She spoke the way she managed trauma patients, the way she had always moved through crisis, not from the outside looking in, but from the inside of it, already ahead, already thinking 2 steps forward. Croft pulled out his phone before she finished. He was already moving into the corridor, already talking, already putting pieces into motion. Voss appeared in the doorway. She looked at Ava. How solid is this? Solid, Danny said from the bed. His voice carried the absolute unqualified certainty of a man who has held information under duress for 6 weeks and knows exactly what it cost him to keep it. Voss nodded once and followed Croft. Ava turned back to Danny. He was looking at her with an expression she recognized. She had seen it on him once before on that road in Kandahar in the seconds before he told her to run. It was the expression of a man who had decided something, who had been deciding it probably for a very long time. I'm not going back in, he said. Whatever happens next, whatever they need from me, I will give them the testimony. I will help them take Mercer apart. But I am not going back inside any system that can make a person disappear and call it classified. He held her gaze. I need you to know that. I know it, she said. And you... She thought about Patricia saying, come back. She thought about Marcus at the medication cart doing the quiet, unglamorous work of keeping people alive. She thought about Clean at the window saying one thing at a time. I don't know yet what comes next, she said honestly. But I know I'm not running anymore. I know that part is finished. Danny looked at her for a long moment. Then he said very quietly, good. It was always a terrible plan anyway. She almost laughed again. She was doing that more tonight than she had in months. Get some sleep, she said. You look like you need it. I need a lot of things, he said. Sleep is probably not the most urgent. It is right now, she said, and the firmness in her voice was the firmness of a nurse overriding a patient, which made him look at her with something that was equal parts amusement and genuine bottomless relief. The relief of a man who has been alone with a very heavy thing for a very long time and has just finally found someone he can put it down with. She stood at the door for a moment. Danny, she said. Yeah. I'm glad you're here. He looked at her. I know, he said. Me too. She walked out into the corridor, 4:17 a.m. The corridor was controlled chaos of the federal kind, low voices, fast movement, the particular organized urgency of people who have been trained to act quickly without appearing to. Garrett was on his radio. 2 additional agents had appeared from somewhere. Croft was at the end of the hall with his phone pressed to his ear and his free hand making the specific gesture that meant hold on and also means something is happening. He ended the call and came to Ava immediately. "We have a problem," he said. "Presidio. Two of Mercer's people were picked up by local PD 40 minutes ago. Traffic stop 3 miles from the address Danny gave you. They had equipment." He held her gaze. "The kind of equipment you bring when you're not planning to leave a witness." Ava's stomach went cold. "Marcus, we have El Paso field agents on the way. 20 minutes out." He paused. "But there's also this." He turned his phone to show her a message on the screen. It was an address. And below the address, 3 words that had come through on an encrypted channel that Croft's team had been monitoring since El Paso. The 3 words were "She knows already." Ava read them. She read them again. "That's not about Marcus," she said slowly. "No," Croft said. "That's about me." She looked up. "Mercer knows I'm here. And he knows Danny talked." She thought fast, moving through the logic of it, the way she moved through clinical assessment, eliminating, prioritizing, finding the critical pathway. "He sent people to Presidio to get Marcus in the documentation before we can. And he sent that message to tell someone here." She stopped. She looked at Garrett. Garrett was still on his radio 30 feet away, his back to them. Croft was already watching her face. He saw exactly the moment the thought arrived. "How well do you know Garrett?" she said. Her voice was completely quiet. Croft said nothing for a full 3 seconds. 3 seconds was a long time for a man like Croft. "He was assigned to this case 8 days ago," Croft said, "by the deputy director's office." "Who in the deputy director's office?" Another pause, shorter this time. "I don't know," he said. And the way he said it, the weight in it, the specific quality of someone reassessing a structure they had trusted told her that he was not being evasive. He genuinely didn't know. And he had just understood that not knowing was a significant problem. "Get Danny out of that room," Ava said. "Right now. Different floor, different wing. And do it without telling Garrett. If I'm wrong about him, then you explain it later and he forgives you," Ava said. "If you're right about him and you don't move, Danny doesn't get to forgive anyone anything." Croft made the decision in the space of one breath. He turned to Voss, who had been standing close enough to hear everything, and said 3 words very low. Voss moved immediately toward Danny's room. Ava watched Garrett. He was still on his radio. He had not turned around. Her phone buzzed. She looked at it. It was a number she didn't recognize. She answered it anyway. A voice said, "Ava Reyes." It was calm, middle-aged, and precisely inflected the voice of a man who was accustomed to making requests that were not refused. "My name is Mercer. I think it's time we had a direct conversation. Don't you, Ava's pulse did not change. "How did you get this number?" she said. "The same way I get everything," he said. "Does it matter? It matters to me." "I'm sure it does. You're very thorough. It's one of the things I find most impressive about you." A pause. "I want you to understand something. I don't want to hurt you. I have never wanted to hurt you. What I want is the documentation that Sergeant Reyes has been holding. That is all. If that is returned to me, there is no reason for this situation to continue. And Danny," she said, "and Marcus. Both free to go," Mercer said smoothly. "Live their lives, quietly. And me, you go back to your hospital," he said. "Back to Ava Reyes. Back to saving people in emergency rooms. Nobody bothers you again." A pause. "It's a reasonable offer. I think you know that." Ava looked at Croft. He was watching her face. She held up one finger 1 minute, and he understood and waited. "You had my team killed," she said. Her voice was flat and even the way a scalpel is flat and even. A silence, fine. Then with a careful neutrality that was its own kind of answer, Black Crest was a complex operation. "That's not what I said. Specialist Vasquez. That's not my name." Another pause. When Mercer spoke again, something in his voice had shifted. Something small, but there. "The offer stands for the next hour. After that, I can't control what happens." The line went dead. Ava lowered the phone. She looked at Croft. "He's not going to wait an hour," she said. "No," Croft said, "and he's not going to let any of us walk away regardless of what we give him." "No," Croft said again. She handed him the phone. "Trace it. And get me in front of a computer with access to whatever financial records your team pulled on Mercer's organization." She met his eyes. "Because the documentation Marcus is holding will take months to process through official channels. But if I can identify the financial architecture, the accounts, the transfers, the shell structures, I can give your forensic team a roadmap that cuts that to days. Croft stared at her. You have training in financial forensics. She looked at him steadily. I have training in a lot of things, she said. Stop being surprised by it. He almost smiled. It was very brief. It did not last. But it was there. Come with me, he said. She followed him down the corridor. Behind them in a room that was now empty, the monitors continued their patient beeping into the silence recording measuring watching over a space that no longer needed watching. Because Danny Reyes was already somewhere safer, already moving, already one step ahead of the people who had spent 4 years trying to close the distance between themselves and the truth. And Ava Reyes was no longer running away from anything. She was running directly toward it. The laptop Croft set in front of her was already open, already logged into a secured federal database that most people with 20 years in law enforcement had never seen the inside of. Ava sat down, pulled the keyboard toward her, and started moving through the financial architecture of Mercer's organization the way she moved through a trauma bay, fast, systematic, already building the map before she had all the pieces, because waiting for all the pieces was how people died. Croft stood behind her. Voss was on the phone in the corner. Outside the door, the corridor had the particular tension of a place where something was being decided, where the invisible machinery of consequence was turning over, and people were beginning to feel it in their chests without quite knowing why. Walk me through what you already have, Ava said. Croft leaned in. 14 shell companies across 6 jurisdictions. The anchor entity appears to be a private security consulting firm registered in Delaware Helix Strategic Partners. It has legitimate government contracts, which is how it maintains cover. But below that, there are 3 subsidiaries that don't appear in any public filing and exist only in the internal records we pulled from Harmon's communications. Show me the transaction flow, Ava said. He pulled up a chart. She looked at it for approximately 4 seconds. Then she said, "This is wrong." He blinked. The data is right. Your interpretation is wrong." She pointed at the screen. "This subsidiary here, Crestline Holdings, you flagged it as a receiving entity. It's not. It's a clearinghouse. Money moves through it in both directions, which means it's being used to layer transactions, not accumulate them." She traced a path with her finger. The actual accumulation is happening here. And here, 2 accounts, different names, but the transfer timing is synchronized to within 48 hours every single quarter. That's not coincidence. That's a managed disbursement structure. She looked up at him. Whoever set this up knows financial forensics. They built it to look like a legitimate consulting operation from every angle that a standard audit would examine. She paused. But they didn't account for someone who was trained to look at funding structures from an intelligence perspective. Because in the field, this is how you track black budget operations. Same architecture, different names. Croft was very still. Where did you learn to do this? 18 Delta training includes intelligence support functions, she said. You learn to follow money because money is how operations stay alive. And if you can find the money, you can find the operation. She was already typing. Give me 40 minutes. We may not have 40 minutes, Croft said. Then give me what we have and let me work. 4:39 a.m. The call from the El Paso field agents came in at 4:39, and Voss took it standing up, which was how Ava knew before Voss said a word that the news was not straightforward. Voss listened for 90 seconds. She said 3 things, yes, confirmed, and hold position, and then she ended the call and came to Ava directly. Presidio, she said. The agents arrived at the address. Marcus Webb was there. Ava's hand stopped moving on the keyboard. Was. He's alive, Voss said quickly. He's alive and he's in custody, protective, not punitive. But the house had been accessed. Someone had been through it before our agents arrived. She paused. The documentation was gone. The word landed in the room like a door slamming. Croft said very quietly, all of it. The physical copies. The drive. Voss held Ava's gaze. Whatever Danny sent him is gone. Ava did not move for a moment. She sat with it. She ran the calculation, what it meant, what it changed, what it didn't change, and she ran it fast because fast was what the situation required. Then she said, did they search the house or did they take specific items? Voss blinked. Specific, what do you mean? Was the house tossed? Was it a search or did they go directly to the documentation and take only that? Voss relayed the question. 30 seconds on the phone, then directly to it, nothing else disturbed. Then they knew exactly where it was, Ava said, which means Marcus told them. She paused, which means they had Marcus before our agents arrived, and they already extracted what they needed and released him. She looked up. It's a message. Mercer is telling us he already has what he wanted. He's telling us the documentation is gone, and there's nothing left to use against him. Croft's jaw was tight. If that's true, it's not, Ava said. He looked at her. Danny is too careful, she said. He has always been too careful. He wouldn't send everything to one location. He wouldn't create a single point of failure. She turned back to the keyboard. The documentation Marcus had, it was real, but it wasn't complete. Danny would have held something back. Something that could stand alone if everything else was compromised. She typed faster. And I think it's in here, in the financial structure. Because Danny's message to me wasn't just about Marcus. He was giving me the roadmap. He was telling me where the evidence was embedded in a form that Mercer's people wouldn't know to look for because they don't know what I know about how black budget money moves. Voss and Croft looked at each other. You're telling me, Croft said carefully, that Danny Reyes left a second trail inside Mercer's own financial architecture. And Danny knew you were the only person who could read it. I'm telling you, Ava said, that Danny Reyes has been planning this for longer than 6 weeks. Probably longer than anyone in this room has been aware this case existed. She paused. He didn't escape by accident. He escaped because he was ready. And he came to El Paso specifically because El Paso is where the federal infrastructure was set up to receive him. He walked into this hospital the same way I walked into that emergency room tonight, knowing exactly what he was doing and exactly why. The room was very quiet. Then Croft said, find it. And Ava found it, 5:11 a.m. It was embedded in the disbursement timing of a subsidiary account registered to a nonprofit organization in Virginia, a veterans support organization that appeared entirely legitimate, that had filed tax returns for 9 consecutive years, that had a board of directors and a public website, and a history of small, credible charitable grants. On the surface, it was exactly what it claimed to be. Below the surface, it had received 11 wire transfers over a period of 3 years, from an account linked through 4 layers of intermediary entities to a CIA operational fund that had been formally closed in 2018. A closed fund, transferring money, to a private organization with ties to Mercer, 3 years after its official closure. Ava stared at it. Her hands had gone still on the keyboard. Croft, she said. Her voice was very even. He came to look over her shoulder. He read what she was pointing at. She watched his face change, the slow, sequential shift of comprehension, arriving in stages, each one heavier than the last. That fund, he said, that's a CIA fund. Yes. That means someone inside the agency. Yes, she said again. Someone inside. Someone with access to closed operational accounts. Someone who could authorize transfers that would look in any standard audit like routine fund management. She looked up at him. Operation Black Crest wasn't run by a rogue private contractor acting alone. Mercer had a partner inside the intelligence community. Someone who could compromise the mission from the inside, cover the forensic trail, and ensure that the unit was buried so completely that no one would look. She held his gaze. That's what Danny has been holding. Not just evidence of what Mercer did, evidence of who helped him do it. Croft straightened. He pulled out his phone. He made a call, and when it was answered, he spoke for 60 seconds. And what he said in compressed, precise federal language was enough to make the person on the other end of the line go very quiet before they said that they would need to escalate this immediately. Voss was already at the door. I'll get the forensic team in here. Tell them to preserve everything as found, Ava said. The chain of custody on this has to be perfect. If there is a single procedural gap, Mercer's lawyers will find it. She paused. Believe me, these are people who have made careers out of procedural gaps. Voss nodded and was gone. Ava sat back. She looked at the screen. She looked at the numbers and the names and the hidden architecture of a conspiracy that had taken 6 lives, 5, on a road in Kandahar. One lived in hiding for 4 years and had been constructed with such care and such patience and such institutional confidence that the people who built it had never imagined it could be untangled from inside. They had not accounted for Danny. They had not accounted for her. 5:34 a.m. Danny appeared at this door at 5:34, escorted by two agents and walking with the careful, deliberate gait of someone whose body was still in the process of reminding them what it had been through. He was in a hospital gown and a borrowed jacket that was too large for him, and he looked in that moment less like the soldier she had served with and more like an ordinary person at the end of an extraordinary ordeal, which was she was beginning to understand what they both were now. He came into the room and looked at the screen. He looked at Ava. He looked at Croft. "You found it," he said. "You knew I would," Ava said. "I knew you would," he confirmed. No false modesty, no performance. Just the clean acknowledgement of a person who has made a plan and watched it work. "The account in Virginia," she said. "How long have you known about it?" 8 months, he said. He came to the table and sat down slowly with the controlled deliberateness of someone managing pain. "I found it 4 months before they took me. I was building the case from inside, trying to document enough to make it undeniable. They found out I was looking, and that's why they moved on me." He looked at the screen. "But by then, I had already embedded the reference data in the transaction records in a way that someone with the right training could reconstruct." He paused. "Someone specifically." "You always trusted too much in my math skills," Ava said. "You always undersold them," he said. "It was the most ordinary exchange they had had. It was also somehow the most significant, because it was the exchange of two people who were no longer hiding, not from each other, not from the pound, not from the weight of what had happened and what it had cost." Croft's phone rang. He stepped out. He was back in 90 seconds. "Garrett," he said. Both Ava and Danny looked at him. "He's been detained." His phone showed contact with a number linked to Mercer's network going back 4 months. Croft's voice was controlled and tightly so. "He was placed on this case specifically to manage what we found when we found it, to ensure that anything we developed could be contained or discredited before it reached the level it needed to reach." He paused. "He didn't know about the Virginia account." "Nobody knew about the Virginia account," Danny said, "except me and Mercer, and whoever authorized those transfers." He held Croft's gaze. "Are you going to be able to hold this whatever I've given you, whatever Elena found tonight? Are you going to be able to hold it against the people who will try to make it disappear?" Croft looked at him for a long moment. "That's the right question," he said. "I know it is," Danny said. "I've been asking it for 8 months." "The answer," Croft said, "is that this goes to the Inspector General's office directly, not through the Deputy Director's chain, not through any channel that Mercer's partner inside the agency could touch. It goes to the IG, and it goes to 2 specific members of the Senate Intelligence Committee who have been asking questions about Black Crest through back channels for the past year." He paused. "There are people who want this to come out. They've been waiting for the evidence to exist in a form they can act on." He looked between Danny and Ava. "You just gave it to them." Danny absorbed this. Then he nodded once with the completeness of a man laying something down that he has carried for a very long time. 6:22 a.m. Marcus Webb arrived in El Paso at 6:22, transported by the field agents who had found him in Presidio. He was thinner than Ava remembered, and his eyes had a particular quality of sustained alertness that came from months of living in the specific tension of hiding while knowing you were being looked for. He walked into the room and he stopped when he saw her, and for a moment he just looked at her the way people look at things they stop believing in. Then he said, "Vasquez," and his voice broke on the single word quietly, the way things break when they have been held under pressure for too long and are finally permitted to release. Ava crossed the room and put her arms around him briefly, the way soldiers do, not soft, not prolonged, but real, present, absolute. "Marcus," she said. "I kept it safe," he said against her shoulder. "Everything Danny sent me, I kept it. But they found it. I'm sorry I couldn't." "It doesn't matter," she said. "We found the other trail. It's enough." He pulled back. He looked at her face. "It's enough." "It's enough," she said. "It's more than enough." He closed his eyes. He stood there for a moment, breathing. The 3 of them, Ava, Danny, Marcus, were in the same room, alive and present, and accounted for, which was a condition that 1 month ago had seemed to belong to the category of things that did not happen. And yet here it was happening in a hospital room in El Paso at 6 in the morning, with federal agents in the corridor and the first gray light of dawn beginning to make itself known beyond the windows. 3 members of a unit that had been erased. Still here. 7:05 a.m. Croft found Ava in the corridor at 7 in the morning. She was standing with her back against the wall and her arms folded and her eyes on the middle distance, which was the posture of someone who had been running on adrenaline and training and sheer force of will for the past 9 hours and was now in the first quiet moment, feeling all of it arrive at once. He stood beside her. He didn't speak immediately. He had learned over the course of this night that Ava Reyes, Elena Vasquez, was a person who needed to be given the space to speak first because what she said when she spoke was almost always more precise and more useful than whatever question he had been preparing to ask. She said, "What happens to my nursing license?" It was not a question. He said, "That's complicated." "Uncomplicated." He exhaled. "The credential fraud is real. The nursing board will have to be involved. There will be a process." He paused. "But the district attorney's office will not be prosecuting given the circumstances, given the classified context, given," he chose the words carefully, "the outcome of tonight." 7 people, she said. 7 people, he confirmed. She was quiet for a moment. "In the nursing board process, what are the odds?" "I spoke to our legal team 20 minutes ago," he said. "With the cooperation you've provided tonight, with the context of your actual training and demonstrated competency, and with some specific advocacy from people who will want to advocate for you." He paused. "The opinion is that a formal exception pathway exists. It's not common, but it exists." He looked at her. "It would mean documenting your actual military medical training, your deployments, your real service record, making Elena Vasquez real again in the official sense." Ava looked at the wall. She looked at her own hands. She thought about what it meant to have a name again. Her actual name, the name she had been trained under, the name on a military ID that had been filed under "Killed in Action" for 4 years. "And Harmon," she said, "he tried to pull my credentials the night I saved 7 lives." "Harmon has significantly larger problems than your credentials right now," Croft said carefully. "His cooperation with Mercer's surveillance request constitutes federal obstruction. He will be fully occupied with his own situation for the foreseeable future." Ava almost smiled. It came and went quickly, but it was real. "Good," she said. Croft was quiet for a moment. Then he said, "Dr. Kleen called this morning, 40 minutes ago." She looked at him. "He's been briefed, broadly, not the classified elements." "Enough." Croft looked at her steadily. "He wants you to come back." Ava said nothing. He said, and I'm going to quote this because I wrote it down. He said, "Tell her the ER is short a nurse, and I have 7 patients who owe their survival to someone whose name I still don't entirely know, and I would very much like to learn it properly." Croft paused. "He also said the trauma coordinator position is open if she wants it, but that he suspects she'll want to stay on the floor." Ava looked at the wall for a long moment. She thought about Patricia, who had said "come back" in the voice of someone who meant more than the words. She thought about Marcus at the medication cart. She thought about Noah, 8 years old, who had gone into surgery with a neurosurgeon she had chosen, who was going to wake up and not know the name of the person who had kept his brain from bleeding out while the surgeon was still on his way. She thought about all the people who came through emergency room doors every night carrying their private urgencies, their accidents and their failures and their bodies turning against them, and how the only thing standing between them and the worst outcomes was a floor full of people who had decided that this work was worth showing up for. She thought about what it meant to do that work as herself, not as a constructed identity with borrowed credentials and a carefully maintained distance from her own history. As herself, Elena Vasquez, who had been trained in the hardest possible school, who had learned medicine in conditions that civilian hospitals could not simulate, who had carried the knowledge for 4 years in a body that would not let it go. "Tell Kleen," she said, "that I'll be back for the next shift." Croft nodded. "And tell him my name is Elena," she said. "He can call me Ava if he wants. Most people will, but he should know my name." "I'll tell him," Croft said. 8:47 a.m. The paperwork took 2 more hours. It always did. The machinery of official consequence moved at its own speed, indifferent to the human urgency that had generated it, and Ava sat through it with the patience of someone who had been trained to endure waiting as its own form of discipline. Danny was moved to a secure medical facility at 7:40. He and Ava had said goodbye in the corridor before they took him brief practical, the goodbye of 2 people who understood they would see each other again, and did not need to dramatize the interval. "Stay visible this time," she told him. "You too," he said. Marcus had given his full statement by 8:15. He was thinner than she remembered and steadier than she had any right to expect. And when he looked at her, before the agents took him to his own debrief, he said very quietly, "You became a nurse." "I did. That's the most Danny Reyes thing I've ever heard," he said. "He told you to run and hide, and you ran directly into the most high-stress, high-stakes environment you could find and started saving strangers." "I couldn't exactly stop," she said. "No," Marcus said. "I don't suppose you could." He squeezed her hand once and they took him away, and she watched him go with the particular feeling of something that had been broken for 4 years, beginning cautiously and incompletely, and with full awareness of how much work remained to mend. 9:18 a.m. She was standing at the exit, cleared to leave, her hospital badge still clipped to her scrub pocket. The October morning, coming through the glass doors in the long, pale slabs of light, when Voss appeared beside her. Voss, who had said very little through most of this, who had watched and recorded and assessed with the quiet competence of someone who was very good at her job, stood beside Ava for a moment without speaking. Then she said, "For what it's worth, what you did tonight, in that ER, that wasn't just training, that was—" She stopped, chose differently. "My mother is a nurse, retired 30 years. She always said the difference between a good nurse and a great one is that a great nurse is afraid and does it anyway." She paused. "I don't think you were afraid tonight." Ava looked at her. "I was afraid every second," she said. "I was afraid Noah was going to die before I could stop it. I was afraid Diane's heart would go out before the cardism worked. I was afraid the whole time." She held Voss's gaze. "I just didn't have the luxury of showing it." Voss absorbed that. "That's what I mean," she said. Ava pushed him through the doors. The morning air hit her cold and actual, the specific reality of being outside after a night spent entirely inside, and she stood on the sidewalk for a moment, with her face tipped slightly upward and her eyes closed, just breathing. She was Elena Vasquez, who had served her country in the hardest places it sent people, and had come home in pieces and put herself back together under a different name and learned to live in the gap between what she was and what she was allowed to be. She was Ava Reyes, who had walked into an emergency room 4 months ago and done the work every shift without credit or context or anyone knowing the full weight of what she carried into every bay and every crisis. She was both of those people, and neither of them was going to disappear. And the question of which name to use in which room was no longer a question of survival. It was simply a question of context, of choosing, of being whole enough to make the choice deliberately rather than out of fear. The car that Croft had arranged was waiting at the curb. The driver would take her to the airport. She would fly back. She would walk into Mercy General for the evening shift. She would take her patients and write her charts and do the work that she had decided 4 years ago was the most honest use of everything that had been done to her and everything she had survived. She opened the car door. Her phone buzzed. She looked at it, a text from an unknown number. And then a second later, a second message that identified the sender that was from the FBI forensic team lead, relaying a confirmation that had just come through from the Inspector General's office. The Virginia account had been frozen. The two names linked to its authorization, one a senior official in a government agency, and one the man who called himself Mercer, were being detained simultaneously in 2 different cities at that exact moment. It was over. She read it twice. She got in the car. She held the phone in her lap for the first mile of the drive, looking at those words. Frozen, detained, over. 4 years of running, 1 night of standing still. And the thing she had been running from had not destroyed her. It had simply been waiting for her to turn around and look at it directly, which was, she understood now, the only way any of it was ever going to end. She put the phone in her pocket. She looked out the window at the city, moving past the ordinary morning-lit life of people going to work and drinking coffee and existing in the uncomplicated way of people who have not had their identities erased by their own government. And she felt for the first time in 4 years that she was moving through that world, not as a fugitive and not as a ghost, but as a person with a name and a history and a place she was going back to. The ER at Mercy General was expecting her for the evening shift. 7 people were alive because she had been standing in the right place at the right time with the right knowledge in her hands. Danny was alive. Marcus was alive. The men who had buried them were no longer free. And Ava Reyes, Elena Vasquez, specialist soldier, nurse survivor, was done disappearing. She was at long last exactly who she had always been. And she was going home.